Live, the morning show from CBS Local 2, where local comes first.
Well, more than 16 million Americans have rosacea. It's a chronic inflammatory skin condition which primarily affects the face. It happens mostly in adults 30 to 60 years of age and is more common in women, especially among those with fair skin. In studio this morning to talk about rosacea is Valley dermatologist Dr. Timothy Joshin. Tim, good to see you this morning. Thanks for joining us. Tell us exactly what is rosacea and what causes it.
Well, as you mentioned, it's a chronic inflammatory condition, and there are really 4 types of rosacea. One of the most common is just redness of your face. You get flushing, blushing, you can have dilated blood vessels. The second type is an acne type. Although it's not acne, it looks like acne because it's red bumps in the central part of your face. Then we have ocular rosacea, where you feel like you have grit in your eyes. And then finally, we have the most devastating type, which is the rhinophyma type, where you have swelling of your nose and cheeks. And W.C. Fields had this type of condition.
Now, what causes this? Do we have any idea yet? And for those who do have it, why is it important that they see a dermatologist?
Well, at this point, we really don't know what causes rosacea. It's still kind of a mystery, but it's important to see a dermatologist because the condition can get worse and it can be very disfiguring. You can have redness, red bumps, and you can get the swelling if you don't get it treated. And
for those who do seek treatment, what are some of the things that can be done? What are some of the treatments that can be prescribed?
As I said, we don't know what causes it, but we do know that antibiotics can help, and we believe it's because of the anti-inflammatory effects of the antibiotics. You can take them orally or use them topically. At our center, we have a lot of lasers, a really big collection, and the lasers are really very effective in getting rid of the redness in your skin. And then I always recommend sunscreen, not only to protect your skin from the sun, but also it helps to calm down your rosacea as well, because sun can actually trigger or make rosacea worse.
You mentioned W.C. Fields is one of the best-known rosacea sufferers. Also, former President Bill Clinton deals with rosacea as well. But you say he's looking a little bit better in recent years, and apparently somebody's doing something right and giving him the treatment to handle that for him.
Exactly. I've noticed that his skin looks a lot better these days, and it could just be makeup, but he looks a lot better. And that's one of the nice things about getting treatment for your rosacea is for women, they can wear a little bit less makeup and look a little bit more natural and a little bit fresher and brighter.
All right, finally in closing, what are some things that people who suffer from rosacea, what are some of the things that they can do at home to care for it as well?
Well, one of the things I recommend to people is to keep a diary on what triggers a rosacea, because there are several triggers that we know of, but everyone's different. So things like red wine, red wine, we have caffeine, hot drinks, spicy foods, exercise, heat can all trigger them. So keep a diary. I tell people you don't have to avoid these all the time, but avoid them during times where you're going to be going to a special event where you want to look your best.
All right, terrific. Any thoughts in closing? Anything we haven't talked about that's important for people to know?
I think rosacea is nice because it's something that I can effectively treat. It's one of the few things where I can almost guarantee you that I'll make you look better if you get started on a treatment.
Okay, certainly sounds interesting this morning. Dr. Timothy Joshin, Valley dermatologist, thanks for coming in this morning and sharing with us some information on this ailment. We appreciate it.
My pleasure. Thank you.
All right. Thank you, Tim.